Good morning to everyone. Myself Dr. Divagar K. I am the AFRS volunteer. Today we are going to see about medico-legal autopsy. This is the overview of today's session. Definition of autopsy, introduction, types of medico-legal autopsy, rules of medico-legal autopsy, objectives of medico-legal autopsy. Then we are going to see about primary skin incisions, some of the dissection techniques, cranial dissection technique, autopsy instruments and references. Now let us start about the introduction. The term autopsy is derived from two Greek words. Autos means self, opis means view. Literally, it means to see with one's own eyes or to see for oneself. In medical science, autopsy or necropsy, it means medical examination of the dead body. Now let us see about the types of autopsy. There are many types of autopsy, namely clinical autopsy, pathological autopsy or hospital autopsy, medico-legal autopsy, anatomical autopsy or academic autopsy, psychological autopsy and virtual autopsy. Now let us see in detail about each autopsies. Now what is the meaning of clinical autopsy? It is performed with the consent of the next of the skin of the deceased person. The objective of clinical autopsies are to determine the disease causing death, that is to determine, clarify or confirm the clinical diagnosis that remained unknown or unclear prior to the patient's death, and to evaluate the efficacy of treatment given, and also to educate the medical students and doctors and for medical research purposes, and also to allow removal of certain organs and tissues for transplantation purposes. Now let us see about the medico-legal autopsy. It is performed on the body of a deceased person. It is carried out under the laws of state only on the requisition of a legal authority responsible for the investigation of sudden, suspicious, violent or unnatural deaths. The legal authority is usually a police officer not below the rank of sub-inspector or a magistrate. Now let us see about anatomical autopsy. It is performed by the students of anatomy under the supervision of the anatomist for study purpose, and also to learn the normal structure of the human body by medical students. It is usually done on an unclaimed dead body handed over to anatomy department by municipal corporation or such other governmental authority. It is also performed on the voluntarily donated dead body. Now we are going to see about the psychological autopsy. It is undertaken on alleged cases of suicide to know about the mental status of deceased at the time of death. To know about we are going to get the sources of collection from family members, friends, professional colleagues, teachers, and physicians. How we are going to get we are going to get the background of the person is habits, mental status, personality, and character. Now, the most recent advances of the autopsy is virtual autopsy or virtopsy. It is a postmortem examination without compromising the integrity of the body, even without collection of the sample. Due to some reason or disease, the autopsy of the dead body is not possible, then by the help of radiological examination, we can detect the cause of death by means of X-rays, ultrasound, CT scan and MRI. Now we are going to see the rules and objectives of medico-legal autopsy. So now first of all we see about the rules of the medico-legal autopsy. It is performed only when there is an official order authorizing autopsy from police, magistrate or the coroner. The body must be identified by the police officer and the relatives, friends and their names must be recorded. In unidentified bodies, marks of identification, photographs, fingerprints and all other means which may helpful must be noted. It should be conducted only in mortuary and never in a private room. It is performed in all the days of a week, inclusive of public holidays, because there should be no delay in the process of crime scene investigation. Inquest report, case sheet, and or summary accident register must be read carefully by the doctor. The autopsy should be performed as soon as possible after receiving the inquisition from the authority. The examination, as far as possible, should be conducted in daylight because in artificial light, color changes are difficult to appreciate. If the body is received late in the evening, a preliminary examination is done to external appearances, body temperature, superficial injuries, extent of cadaver lividity, and rigor mortis. The actual postmortem examination may be conducted on the next day. No unauthorized person should be present at the time of autopsy. The investigation officer may be present. In each and every case, examination must be thorough and complete. All cavities must always be open because evidence of factors contributing to the cause of death may be found in more than one organ. Even if body is mutilated, fragmented or decomposed, autopsy should be performed as certain evidence may still be discovered. Nothing should be erased and all alterations must be initialed in the report. After completion of autopsy, the body is handed over to the police officer. Postmortem report should not be issued to the party. If any discrepancy in the injuries noted in the inquest report and those found on the body, the investigation officer should show in the injuries so that necessary corrections may be made in the inquest report. Now, we are going to see about the objectives of the medico-legal autopsy. The main objectives are to determine the cause of death, to determine the manner of death, and to estimate the time since death, and also to establish the identity of deceased when not known, and to document the injuries and to deduce how the injuries occurred, and to collect evidences to identify the object causing death and to identify the criminals, and also to retain the relevant organs or the viscera and tissues as evidences, and also to determine the question of viability and live birth in newborns. What are the primary skin incisions? We have I-shaped incision, Y-shaped incision and modified Y-shaped incision. We have three types of incision: I-shaped, Y-shaped and modified Y-shaped. I-shaped incision, it starts from chin and ends in the pubic symphysis. Y-shaped incision, it starts from the biacromion process and it goes through below the nipple of the bilateral side and xiphoid process and it stop at the pubic symphysis. This is Y-shaped incision as you see in the first picture, like a Y-shaped. Next, what is the meaning of modified Y-shape? As modified Y-shape, we are going to take the incision from the bimastoid and there we are going to come to the suprasternal notch and straight we are going to reach the pubic symphysis. This is the common autopsy incision we are following in the mortuary. Now let us see about the dissection techniques. There are four types of dissection techniques are there: Virchow's technique, Rokitansky technique, Letiol's technique and Gon's technique. In Virchow's technique, individual organs removal will be there and then we are going to do the dissection of the organs. Rokitansky, we are not going to remove the organs out from the body, but we are going to see in situ, that is inside the body cavities we are going to do the organ dissection. Letiol's technique, here we are going to remove the organ en masse and then organ separation and then organ dissection we are going to perform. It is the most common method of dissection techniques followed in all the postmortem examination. What is a Gon's technique? Gon's technique, it is a block-wide dissection and then organ separation and organ dissection. So we have seen about the dissection of internal organs. Now we are going to see about how we are going to remove the brain from the skull cavity. It is a cranial dissection technique. It is a bimastoidal incision, that is from the right side or left side of the mastoid and it ends in the other mastoid. We are going to put an incision and the scalp retraction has to be done. Then we have to see about we are going to see the skull vault. So we are going to use a V-shaped incision for that, opening the skull cavity using the bone saw. So with that we are going to remove the brain outside. Now let us see about these are the common autopsy instruments which are used for removal of the organs or organ dissections. Example, entrotome. Entrotome will be used for the alloviscerous dissection, and brain knife is used for dissecting the brain, and tooth forceps will be useful for holding the tissues, and bone cutter will be used for cutting the bones, and bone saw will be helpful in the cranial dissection techniques, and rib cutter will be helpful in opening up the thoracic cavity for cutting up the ribs, and scalpel will be used for the primary skin incision and the other incision purpose, and dissecting scissors will be used for dissecting the organs. And most important, we will be opening the skull cavity with the use of chisel and hammer. So these are the common autopsy instruments which will be helpful in the postmortem examination, and these are my references. And thank you. Especially I have to thank Mr. Rakesh Mia sir and Mr. Vijay Pal sir for giving me this wonderful opportunity for sharing my knowledge to all. Thank you.